Welcome back to the Chase MedSearch podcast. My guest today is Melissa Davidian, and she has spent over 30 years in sales and sales leadership in the chronic pain space, including 16 years in neuromodulation, which I know is important for a segment of our audience. She's well respected and really well liked by her peers and teams that worked with her and for her. Just a stellar reputation. Today, she's the president of Intersection Coaching and Consulting, focused on the transformation of her clients by connecting the body to the mind by blending neuroscience principles and physiology through the foundation of energetic coaching and somatic practices. You can go to her website, review her coaching practice, and read her blog at intersectioncoaching.com. Welcome, Melissa.
Hello. Thank you for having me.
Yeah, it's great to have you on. I've known you for some time. I've always bugged you about referrals or tried to recruit you away to other things. And I'm jealous because you started your business and went on another podcast before you did mine. But I'm glad to be second and have you on. What's that?
I understand. I just needed some practice.
Oh, yeah, sure. No worries.
Sitting with my good friend.
No, that's great. I always love to start out with my guests about how they got into healthcare sales. And it's a big topic, and certain people who dial in because they want to break in. You had a very successful career in pharmaceutical sales, transition to medical sales. Can you kind of just give us a shorthand version of that in your career?
Yeah. It was, I started working with Pfizer and sold pain medications and developed a great reputation and territory with Pfizer for the first 8 years of my sales career. And then it was actually one of my physicians. I had shared with him that I was just needing more stimulation in work and wanted to be closer to the patients. And he said, I think you'd be really great in neuromodulation. And so then I interviewed at the time with both ANS and Medtronic. And neither of the organizations had a role, as much the case with device. You're kind of always keeping that bench warm. So I waited for a year, and it was my good friend Jeff Orr that stayed in touch with me and said, "We'd love to have you. We'd love to have you." So I started with ANS.
That's great.
Gosh, what is that? 19 years ago now, I guess.
Yeah, that's fantastic, and had quite a career in neuromodulation. You were a sales trainer, you were a sales leader for them. Just for anybody listening that wants a leg up in their career, what do you think was key to continuing to progress in your career and grow into those kinds of leadership roles?
Well, as always the case, it's the mentors that you have. It's the business that you build. It's your physician partners that become some of your biggest advocates. And it's, I don't know that you can say it's one thing. It's really a matter of minding all the elements of the process. In med device, especially neuromodulation, the reps play such a critical role with the practice of the physicians. And so really just understanding that every single person within the physician practice is important, as well as your patients. It's really about running your business to the best of your ability and matching that excellence that the physicians also need and also really care about.
Mm-hmm. Yeah, that's great. I love to have folks on from all different corners of the medical device universe, but I especially love Neuromod because I know it so well. And I always say these people can do anything. They can literally do anything. And you're doing something new now. You have your own coaching business. Can you tell us about how you launched that, how you decided to take a pivot and a turn away from kind of the medical device, focus on chronic pain, and industry into this segment of your next journey in your professional career?
Oh, absolutely. And I think that it was my role in neuromodulation that led me here naturally, because um, as a rep, we were able to develop such a relationship with the patients that we were involved with, and really helping with neuromodulation. And something that always fascinated me was that some patients would do really, really well with stimulation, and others would do well, and then maybe the therapy would wane,
Hmm.
or I really became fascinated by the outcomes and the tie to the belief in the therapy, and not only the belief in the therapy, but really the belief in their physician, belief in their own uh, participation in their own wellness and their own journey. And what I really came to observe, very, just personal observation, was that there was always this mental emotional element underneath the outcomes that we'd have with the patients. And it was almost as though my role as a rep in required a certain level of psychology in interaction with the patients.
Hmm.
And so that, plus my own dealings with stress, really led me down this path of really wanting to understand the body mind connection.
Hmm.
And I would always be fascinated when the physicians would say, the only thing that really affects these outcomes with STEM is that we need better devices. And I kept saying, our devices are really good and really effective in all of the studies, especially now with all the
Hmm.
products on the market. They have amazing efficacy, really, for a very difficult patient to treat. Um, but there's still a part of that patient that I think we're not treating, and that's the mental emotional side of being a chronic pain patient. I think our system just isn't set up for that yet.
Yeah. To give folks a snapshot, when you were in a regional sales leadership role, how many reps were you managing? How many clinicals and how many patients would you estimate you were seeing in this kind of situation? Because I mean, you got a deep foundation with pain patients, and I don't know if you were in pain at Pfizer as well, but
Yeah, so I was, but with pharmaceuticals, you're not as connected to the patients. I think I don't even think they allow you to be. But for the 10 years that I was a rep, I mean, it was over 1,000 patients,
Mhm.
probably if not more. And then when I became a regional sales director, I wasn't, again, as closely tied to the patients as I was as a rep. But I had a team of, I think we had about 13 people on our team, 13 reps on our team, Southern California.
Okay, Southern California. Yep.
And so then, you know, that would be 1,000 patients a year.
Yeah.
But yeah, it was a large group, a large population. And, I had quite a few patients, because they always had my cell number. I had quite a few patients that I stayed in touch with, even as I've moved on and
Yeah.
um, stepped out of the field.
And you witnessed thousands of people struggle with persistent health challenges.
Yeah.
And you saw how mental and emotional stress quietly, I like how you said that, it quietly takes a toll on the body. It made me feel like it kind of sneaks up on people. They're not realizing what it's doing to them. And then you had a personal experience. Can you share that with us?
Yeah, sure. Let's see, when was it? It was in 2015, 2016. I was, working as we do, 50, 60 hours a week. And I was raising my daughter, running a household, taking care of my mother-in-law. It was, the typical story. I don't think my story was any different than many working mothers, but I ended up in with some health issues, actually from head to toe. I had chronic migraines, um, digestive issues, chronic pain. Like, I was on a handful of pills every day, and I had these episodes that took me to the ER where I couldn't speak and I couldn't um, hear, I couldn't walk. It was really frightening. And after a series of MRIs, I was told, it's a complex migraine, which is likely tied to stress.
Hmm.
And so I started reading, just really diving into that mind body connection, and found that there are a number of physicians that have written books about what stress can actually do to the body.
Hmm.
And so I made some changes and really started focusing on my mind. And within about 6 months, it all disappeared.
Hmm.
I haven't had a headache since, and I'm I'm not in pain at all, and I've actually feel like I'm getting healthier as I get older, and so I just, again, have really developed this understanding that, number one, stress absolutely takes a toll on your body, because we now live these lives that really keep us in that fight or flight mode, which keep us in that sympathetic activation. And
Hmm.
so we have to actively and intentionally create space to give ourselves a break.
Yeah. Wow. Was there anything in particular about your job that you found stressful that was additive to the stress that you're already experiencing in your life? Anything? I'm just thinking of my audience, huge section of neuromodulation people.
Yeah.
Is there anything unique about that job that you'd say is maybe a little different than other types of jobs people might have?
I think with neuromodulation, I think that one of the challenges is that you wear so many hats, and you have to be everything. You're not only in the operating room, but you're involved with patient care. You are negotiating with hospitals and contracts, and you have a number. It is an incredibly complex sales role. I
Hmm.
think if you compare it to other med device roles, and Jordan, you would know that even more than anyone. But I used to say, as a regional sales director, it has to be one of the hardest people to hire, because you have to have so many facets
Hmm.
and the ability to be so many types of a rep in one.
Hmm. And have
And
that
so,
inner resilience to be able to handle, I think, additionally, the component of the patient. And when you're dealing with
absolutely,
chronic pain patients, that certainly is also, I would guess you'd agree that that's an added stressor also, because now you're
it
in a
is.
counselor role many times,
Yeah.
you know?
Absolutely. Absolutely. But it's equally, and I think we all of us would agree, it's equally rewarding from
Mhm.
because of all those elements, right? I mean,
Absolutely.
it really gives you the ability to um, stretch beyond what many other jobs would provide. So,
Mhm. Some of your material talks about focusing on the energy behind the illness, not just the symptoms. What does that mean?
it comes down to um, the my belief that we see the world really through a certain lens or perspective. Every single one of us has our own perspective, and that's based on really our programming from early childhood. But the energy coaching that I do actually runs through 7 different levels of energy, from very catabolic energy, which is more of the victim
Hmm.
fighting kind of energy, to very high anabolic states, which are joy and compassion. And we all float in and out of those states depending on the situation. But the ability to understand how you see the world, to be able to create space between that lens and your intention of how you want to be in the world, is incredibly powerful. And once you have that understanding of how did you get here, how are you moving through the world, and how do you want to be, you're able to, I mean, and when I talk to people about this, with their own energetic profile, the light bulb just goes on of, oh, that's why I do that. Oh, oh. And then they start seeing, oh, I don't have to behave that way. I don't have to, when I'm triggered, you know, get frustrated and slam the door or what, whatever the situation is. We all have the power to choose. And that's the I think that one of the most powerful things that I get to share with my clients now.
Hmm. Absolutely. There was something you said I listened to your other podcast too. You said something about, and I'm going to get this wrong, so correct it, something between uh, the actual event happening and your reaction to it, there's choice in between, which I thought was
Yeah.
really interesting. And it made me think about that. Instead, you're not prisoner to reacting immediately. Is that?
That's right. And that was a concept that Dr. Viktor Frankl wrote about. And I don't know if you've are familiar with his work, in his book, the Man's Search for Meaning.
That I have
Um,
read. Hmm.
yeah. So he was a psychologist in the concentration camp
Hmm.
in Nazi Germany. And as he's there in probably the worst, I mean, really one of the worst, most horrific events in history. And he survives, and he really determined, well, what is it that allows someone to survive something that horrific? And it was truly the power of choice. That the quote is, between stimulus and response there is a space, and
Hmm.
in that space you have the power to choose. And that has probably been one of the most inspiring books that I've read. I read it every
Hmm.
year. But it's also, I think, one of the most powerful things that we can learn as humans as we move through life is having the ability to, when you're triggered, take a deep breath to feel what that feels like in our body,
Hmm.
and then to make a choice of how we behave. And I think when people just learn that, it's incredibly powerful. It changes a lot.
Hmm. People in our space, the device space, are typically pretty stressed out. If they're not
Yeah.
stressed out, they're supremely organized and disciplined, and there's all these things, and there's a cadence and rhythm. But something can happen and throw a monkey wrench in that, and then all of a sudden, what's been so carefully set up begins to go a little haywire. If someone were listening to this talk we're having and wanted to maybe perform some kind of a self-diagnostic and say, I hear what they're saying, they're kind of talking about, if we were to put that in concrete terms, do you have people run through a self-assessment or self-diagnostic check if they're driving between LA and Orange County or something right now and looking and saying, I do, Melissa, this is making sense. What do I do now? Or how would I begin to know that I'm really in need of some of this?
Well, that's where the somatic element of my coaching comes in,
Hmm.
because and really it's the somatics and the mindfulness.
Hmm.
I really encourage um, people to have a mindfulness practice now. And for us, again, in the very busy worlds that we work in, mindfulness is not necessarily needing to dedicate an hour every day on a meditation pillow, right? Because how many times have, when you suggest meditation, people say, oh, I tried that and I couldn't shut my mind down, right?
Mhm.
It's not mindfulness is really I love Dr. Ellen Langer's definition of mindfulness, and that's actively noticing. So if I would could encourage people to really, when they are triggered or when they feel stress or when they feel that feeling, if they could literally just take a few deep breaths and feel what it feels like in their body and make that connection, because even just that little practice alone, you can do it anywhere, but that gives you that gap, right? That gives you that space instead of, and I think what we tend to do is we tend to be, because we are such type A kind of people, we tend to put more action into that space instead of taking a step back and just breathing.
Hmm.
And so I think the more that we're able to learn that and practice it. And so what I suggest doing is just practicing the breathing, and just a few times a day. It's the to calm your nervous system. There's a way you should breathe. And
I'd love to hear about it. Yeah.
yeah, so it's
I think I need some of that.
yeah, I think the one of the easiest breaths to remember is breathing in through your nose to a count of 3, holding for a count of 3, and then breathing out through your mouth as if you're breathing through a straw twice as long. So the key to calming the nervous system is the exhalation, and you want it to be out through the mouth, like again, like through a straw, longer than your inhale. And so some people will do like a 4-8 count, some will do a 3-6 count. It doesn't matter, but it's that exhalation that really calms the nervous system. Um, and so even just doing that a few times a day, and just really getting it into your psyche
Mhm.
of, I have the power to calm this, so that when you feel yourself getting stressed, you can go through that process and find that space for yourself.
A reminder for those who don't know, we're not just a podcast. We are a medical device recruiting firm, and we fill positions nationally. There's not one state I know of where we have not made placements. Visit chasemedsearch.com to find our latest position listings. You can also find me, Jordan Chase, on LinkedIn, and I post up-to-date position listings there. I'm capped at 30,000 LinkedIn connections, so you can follow me on LinkedIn, but unfortunately, I can't accept your invitation if you send me one. Finally, if you've got feedback on our podcast, please email it to me at jordan@chasemedsearch.com. I love suggestions for topics for the show. And if you like what you hear, please subscribe on YouTube. It does help grow the show. And now back to our podcast. You've been doing this for a bit now with your coaching business, but you were coaching reps in the past, so I'm sure there's parallels there as well.
Yeah.
When you think about maybe one of the toughest cases in terms of persons you've encountered where they're coming to you, they need the help, they're coming to you in your coaching business. Lay that out for us. What did this person look like when they first started working with you? Maybe tell us about that process too, because I'm sure there's some people that come to you in some pretty as much distress as you were in
Yeah.
when you were
Yeah.
having stress symptoms that were ending up in the ER.
Yeah. Well, it's, when one of my clients had a really tough time with anger and some addiction elements there.
Hmm.
And so we started really just, and was also a little leery of even talking to a coach anyway, because, that's kind of woo woo, and I'm fine. I'm just fine. I'm fine. And so, we started really, real slowly of just really talking about, okay, what do you want? Let's not, yeah, I'm not going to, this is a safe place. There isn't any
Mhm.
judgment here. What do you want? And we start there. And then, as I build trust, which is a very, very big part of this process, then I was able to uncover, well, these are the triggers. These are the things that set them off, and okay, so where's that coming from? And we would go back to, really tie it to things that happened in childhood.
Mhm.
We were able to uncover there was some shame there. There was some, not feeling of unworthiness. And just piece by piece, by talking, really through talking through these different elements, and then kind of putting together the puzzle of the anger that you're feeling, you're escaping through the alcohol, and then really pulling the whole puzzle together, we were able to incorporate that mindfulness, break through some of those patterns, and then reframe, allow him to reframe his life. And when you start just with one little piece, whatever's most urgent, and you change that one little piece, it's sort of like pulling a thread from a seam, right? It sort of opens up the door. And when someone has their expectation that they're just going to see, this, all this frustration and all of this miserableness, and they start to see, oh, there's a different perspective and there's a different light, all of a sudden, it's, I love the analogy of glasses and the lens you look through. It's almost like he was able to put on a different set of glasses and start seeing a different set of outcomes.
Mhm.
And it's a similar process really for everyone, whether it's someone that just wants to be better at sales, or
Mhm.
someone that really has some major life things. The process is much the same, because we all go through the same process to get to where we are today.
Mhm.
We have things that happened in childhood. We have traumas. It's whether they're little t traumas or big T traumas, but they all shape us. And
Mhm.
so once you start to understand that there really isn't space for shame, because we all have felt it, it's a very human process. It allows people to give themselves more grace than I think we do.
Mhm. It sounds like perhaps a misconception clients may have when they come to you is you're just going to fix one thing. I just need to fix this one
Yeah.
thing. And if I can fix that, everything's golden, you know.
Yeah.
But
Yeah.
a lot of things are intertwined and tied
They
together.
are.
And
They
there,
are.
go
And
ahead.
it's interesting that you say that too, because that's, when patients go to the doctor, they just want to fix that one thing, right?
Yeah.
And the
Hmm.
challenge is they can fix that one thing, but if that the underlying reason isn't addressed, they're probably going to be back to fix another thing,
Hmm.
and
Yep.
another, and another, because our bodies do store this energy, and when it isn't dealt with mentally or emotionally, it does, I believe, really contribute to long-term health issues.
You've mentioned that there are several surprising truths you've discovered in your coaching overview on your website, and let's talk about these for a second. One is you will always find exactly what you're seeking or expecting. What does that mean? Because that's interesting.
Just as I the story I shared,
Mhm.
if you look through, if you're looking through a lens that the world is happening to you and you have no control, then you're going to see support and evidence of that every day.
Mm.
If you look through the lens of the world is a wonderful place and every bump in the road is an opportunity, you're going to find that too. And so it's just it to me, it is such a truth that you will find exactly what you're looking for.
Interesting. Another one that jumped out at me was our subconscious is programmed by the age of 7 and it controls 95% of our life. That's very interesting. Tell us about that, how that happens and what that looks like.
So the and that age is up for debate, I have to say,
Okay.
in different some people say up to age 10, but our brain is in theta. um we're operating in theta states in that early childhood time frame, and that's where you are like a sponge, right? You're just absorbing. Your only goal in life is to be loved, to fit in, to be fed, have your needs met,
Mhm.
and that's really our human beginning. Is all of us are in that mindset. And so what happens is that the environment that we're in is teaching us of all our limiting beliefs, or if your mom and dad feel this way, or your primary caretakers feel this way, that's being programmed into you.
Mhm.
And so our child mind that doesn't have the ability to logic or reason yet is creating these agreements, um, from the perspective that my world is all around about me. So if my dad is angry because he had a horrible day at work and he comes home and he's upset with me, I must have caused that, because that's the child mind programming. So those first 8 to 10 years are where we develop our subconscious, and it's programmed in that time frame. And so you spend the rest of your life really operating from that programming. So that's where, if you become a perfectionist because you want to be perfect so that you can be perfectly lovable, that's where we develop our that element, plus the fact that we don't feel worthy unless we're perfect, where we can't take criticism because then that means we're not lovable. So all of those things are attachment um,
Mhm.
tendencies. All of those things are programmed in those first 10 years of life.
Mhm.
And now that I know this, and it's been discussed and established by many in the medical community. I told my daughter I wish I could go back and be another mother to her
Mhm.
because it's so fascinating when you understand the impact of those early childhood years, and how we spend the rest of our lives trying to get back to who we
Mhm.
came here to be to begin with.
Mhm. Interesting. You know, a theme that's kind of running throughout this whole discussion is the body mind connection. And one thing that it makes me think of is working out is great, it's not enough. And I know many in our industry are very fit, and it's just part of their life. It's
Very.
what they need. They release stress that way. But the things we're talking about, working out doesn't necessarily cure, although it might be part of what you'd recommend, right?
Yes.
Because I imagine somebody's sitting here thinking, "Oh, well, body mind, I bench 300,
Yeah.
or whatever." I don't, never have, never will, but but
Me
someone might
neither.
be thinking that, I'm been an
Yeah.
athlete, I'm fine. But
Yeah.
there are other areas where it's just not that's not curing what, or not helping what they're struggling with.
Well, it does, though, right? It is absolutely critical and important.
Mhm. Okay.
But I think the thing to remember is that when you say the body mind connection,
Mhm.
the mind also includes our emotions. And a workout isn't necessarily going to help um, with that emotional, with any emotional gaps, right? I mean, it's very similar. So coaching or for some therapy is actually that element,
Hmm.
the way that you treat the emotional part of our mind, while just as you treat the body with you know a wonderful diet and exercise. So I think we're really good at identifying things and needs in the body. I think it's harder, and as a society, it's harder for us to really identify what we need from a mental emotional place. And I think that's, not everyone needs a therapist. Some people do. Some people come to coaching and they really should be seeing a therapist. But I think for most of us, we're incredibly successful people. But maybe our relationships just aren't as fulfilling,
Hmm.
or maybe there is, to your point earlier, maybe there is just, one little area that you're not slaying in life. And
Hmm.
that's a great place for a coach, because you can help uncover that gap and move forward.
On that note, you are a holistic well-being coach. How did you become
Mhm.
one? What's the process? What are the certifications you have? And tell us about
Yeah.
that.
Yeah. So I'm certified professional coach. I have credentials from the International Federation of Coaching, which is really, coaching is such a random
Hmm.
new area, and you don't necessarily need all those credentials. But it's, from my perspective, again, because I come from such a scientific background, I didn't feel like I would be providing the best experience for people unless I did gain the certification. So I
Hmm.
now have virtually a master's level of education around coaching, and I continue. I'm doing a really good somatic based coaching program this year, and it's phenomenal because it really does get into many of the scientific elements to treat people with pain, but also to treat people with um, severe anxiety,
Hmm.
um, and depression, and some of the other deeper challenges out there. And so it's something that I absolutely will always stay up on. There's so much in this coaching world that's evolving, and there's so many tools. There's um, the polyvagal society has a lot of information. Even Dr. Stats um, is involved with the Vagus Nerve Society, and they're putting out education. So I am as much as I'm coaching, I'm also maintaining my education, because there's just so much, and it's
Hmm.
really important to me.
I bet you wish you had some of this when you were running a sales team too.
Absolutely.
Would have been
Oh,
helpful.
absolutely. Yeah.
Yeah,
It is.
yeah.
It's that emotional, that EQ component that I've always really um been attracted to. And even I think that's what I loved, as a rep and a sales leader, is just being able to really lead a team and to help people become the best that they could be. It's incredibly rewarding for me.
Your website outlines a 12-week program,
Yeah,
suggested, I think, right? Can you kind of just give us a light overview of what 12 weeks looks like working with
absolutely.
you?
We start with an assessment, and it's called the Energy Leadership Index, and it's actually more of an attitudinal assessment, and it helps us uncover really what those glasses are, as I keep using that analogy, how someone sees the world. From there, we'll actually go through an outline of the 8 major domains in life and identify where someone wants to really focus their time, to your point, to that person that just has that one thing. Well, we'll start there. We'll just start with that one thing. But then we'll go a little bit deeper and really looking at what um, the subconscious programming is. Where are those limiting beliefs that are really creating that blockage? Does someone have a feeling of worthlessness? What are those underlying emotional elements that are creating that blockage? So then we'll go through some mindfulness training, basic somatic connection to the body, and look at and determine if there's anything that needs to be released there. And we'll work through some activities that way. And then we create an action plan to help reprogram the subconscious to something now using our logical mind, um, and to create a plan of accountability to move forward. So, and it does take about 12 weeks to get through that.
Mhm. Yeah,
Yeah.
that's great. Have you got people going beyond that, or is it typically touch points after that, or
Yeah,
how
then
does
I leave
that
it
work?
up to each person. Some people like
Mhm.
to just continue like every other week, just to have that consistent accountability. And then as things come up, they can call or reach out to me. I have someone that I've helped through a job transition. Different things in life come up, but my goal with every client is um, through 12 weeks to really be able to walk away with a toolbox, if you will, so that regardless of what comes up, they feel more empowered and better able to handle it than before we worked together. And so that's really, you know, the mindset that I create with them, that this is not necessarily a forever thing, but yet I'm always here. So,
Mhm.
and once you develop that level of trust, it's just nice to have someone that's unbiased in your corner, that you can say, hey, what do
Mhm.
after you go through a process like that, I get to know people pretty well. So they feel really good about saying, okay, this is the issue I'm dealing with, help me through this. And the reality is the answers are always inside of us. My role as a coach is just to help people get there, to validate their
Mhm.
own feelings and hopefully learn to tap into their intuition more and more.
That's terrific. How can people find you?
Well, my website is wonderful, intersection coaching, and that's INNER, intersection coaching.com. I'm there, and they can find me, at Melissa Davidian on LinkedIn, or
Mhm.
intersection coaching with on Facebook and Instagram as well.
We'll link to all those when we publish the
Great.
episode. And I just want to thank you for being on. I think this could be really, really helpful for a number of people. And I assume you're open to taking new clients.
Absolutely.
Is that
Yes.
right?
Yeah, I
Okay,
definitely
good.
definitely have some room. Thank
Excellent.
you.
Excellent. Thanks again for
It's
being on,
wonderful to be here.
Melissa.